Our next speaker is the president and CEO of the Erickson Institute. He is a pioneer in the field of early childhood development and education. Our next speaker joined Erickson nearly 4 years ago. He earned his bachelor's degree from Duke and 2 master's degrees and a doctorate from Tulane. Ladies and gentlemen, Dr. Geoff Nagle. Geoff?
Well, thank you, Jay, and good afternoon, everyone. It's certainly a pleasure to be back at the City Club. And as I begin today, I want to thank our partners and our funders on this project, many of whom are in the room today. So thank you all to make this day a reality and for being here to support this. And I want to start by thanking our co-authors on the report. So Erickson wrote this report with partners from the Illinois Early Childhood Asset Map at the University of Illinois and Voices for Illinois Children. And we had great support from a large funding community here, which is very supportive of these early childhood efforts, starting with the Irving Harris Foundation, the Pritzker Children's Initiative, the McCormick Foundation, and the Stone Foundation. So it took a big effort, a big team, and in addition to that, we had an advisory committee of 40 and a stakeholders group of over 60. So we had lots of input, lots of people involved to produce the Illinois Risk and Reach report. And today is really a sneak peek of the report, a first look of what we're calling Risk and Reach, which will be available for download on March 29th. And this report is designed to be a much deeper understanding with a level of precision that does not exist about how our children are doing and what's happening for our youngest children. And for the first time ever, you will see how we are doing county by county with creating our future. So first, I'll walk you through the key findings, and then I'll turn it over to my colleague, Dr. Cristina Pacione Zayas, and our illustrious panel of leader experts for a deeper discussion of the report and its implications. So this report is designed to show you the risk, not the individual risk of children, but the risk in the environment that the children are growing up in, by looking at risk facing children county by county, and then the reach, the services and supports that to mitigate the risk that are provided by our state government. And I want to note that the resources we talk about today are just the state resources, not the local resources. So let me start by first laying out a few basics about the population of Illinois. There's about 12.8 million people, and this visual shows you the demographic in terms of race and ethnicity. And this is the breakdown for children 5 and under. So there's 945,000 children 5 and under.
To give all our children the best start and ensure greater equity, we need to understand the strengths and challenges of Illinois' early childhood efforts. Illinois' first Risk and Reach report provides county-by-county data on the well-being of young children, as well as data on public resources available to them. The report maps risk factors in a community that affect family stability, health, and early care and education. The report also shows publicly funded services and programs that reach children and families to address risk factors. This data will inform conversation and ignite action for better resource allocation, dismantle structural barriers, and create solutions to address gaps. Who will use Risk and Reach? Elected officials and policymakers to inform policy decisions and resource allocation. Advocates to promote equitable distribution of resources for optimal child development. And grassroots leaders to drive collective action at the local level. By strategically investing in family services and child development programs, we can improve health outcomes, academic achievement, and the future success of all our children.
We start with risk factors. So we estimated risk in 3 categories: family stability, health, and early care and education. And within those, there's 15 risk indicators. And for each of these indicators, we mapped across the state, county by county, the level of risk. So whether it's poverty or maternal education or all of the 15 you see up there. And we create these heat maps in shades of blue. So the lighter the shade of blue, the less risk. The deeper the shade of blue, the more risk. So what's important on this visual is not the name of each county, but what we're going to do, I'm going to scroll through the 15 maps that get us to an overall risk score. And what I want you to notice is how the colors change on each map. Because when we talk about children at risk, we often paint it with a very broad brush. But this report is designed to give us precision based on the risk factor that we're talking about. So the key here is that you're getting insight into what are the risks, and it really varies county by county. So I'm just going to go fairly fast and just pay attention to the change in the colors. Okay, so this is the composite map, and you saw the colors change depending on the risk factors. So a lot more precision, and I want to highlight this by showing you now one county, and obviously the appropriate county to show you would be Cook County. So I'm going to do the same thing on those indicators, just showing you Cook County. Now, Cook County is a county that is at that kind of third highest level of risk, what we call high moderate risk. But you'll see as you look at the indicators, it really varies. Some they're at the highest risk and some at the lowest risk. And as I mentioned, so overall risk for Cook County was high moderate. So overall, 12 counties were in the low group, 39 low moderate, 36 high moderate, and 15 were high. But the name of the game here isn't the counties having risk, it's the children in the counties having risk. So how many children lived in those counties? Well, looking at it by percent, you see that about 1/3 of the children were in the low or low moderate group, whereas about 2/3 or 68%, more than 2/3, are in the high moderate group. And it's these kids that we're the most concerned about because it really tells you that there's a great accumulation of risk, that there's several or many risk factors that the children are being exposed to or, let's say, threatened by. So it's the accumulation of risk that is the greatest threat to children's development. And the number of children in these counties is 643,000. So it's a lot of kids that we have to be concerned with because of what they're facing out there. So a few takeaways. Again, this is the overall risk map, a composite of all the risk factors averaged across, and then their average score puts them in one of the 4 categories from low to high. But there's a few key takeaways here. Let's call it the good news and the bad news. Starting with more or less the bad news. 81% of the counties rated as a high risk on at least one indicator. So even if you're a light shade of blue on the map, most likely you have at least one indicator that's in the high group. So a real opportunity for growth in every county. And you see almost every single one was high, moderate, or high. But on the flip side, even if you're a high-risk county, you shouldn't be condemned because you have plenty of strengths as well. And so 3/4 of the high-risk counties, the deepest blue up there, had at least 2 indicators that were low or low moderate. So plenty of assets to work from, and a level of insight and precision at the local level so that people understand the strengths and the opportunities for growth to build for their children. So the next part of the report is the reach. And the reach are the services and supports to mitigate the risk that the state provides, again, excluding those local investments. So what we do is we show the overall risk map, and then we overlay on the map various services. So in this case, we're talking about high-quality childcare. So the state has a quality rating system. The highest level is gold. And this map is going to show you, by putting circles on each county, what percent of children who are in the state subsidy program getting help paying for their child care, what percentage of those children are in a gold level of care. So the smallest dot is no children in that county, and the highest dot has a big range there from about a quarter to 75 or 80%. So here's that overall risk map, and the circles on there, and just to help you break this down. So this first area up here that I point out, Cook, Kane, DuPage, DeKalb, and Will, you see a fairly good amount of higher quality care there for these subsidized children. But as we head south to Kankakee, down to Vermilion, Edgar, and Douglas, and even Coles, all with moderate high or high risk in the county, there's no high quality childcare there available. And then there's other high risk counties, such as Peoria and Rock Island, that you do see a higher percentage of the service available. So one other example, because there's 17 of these in the report, and I'm just going to highlight these two. The second one is mental health service. So the biggest circle in this case is a maximum of just 26% of children who are on Medicaid coverage, meaning basically receiving public health insurance for children. So just to show you here, Warren, Fulton, and Vermilion, elevated risk and at least some level of service. We see Franklin down south with high risk and high services. And up north here by Stevenson, where you see a discrepancy just in neighboring counties between higher service and lower service. So these are just some examples of what will be in the report, so you can really start to look at these communities and wonder what's going on, what's working right, what doesn't seem to make sense, what do we want to understand more about. So the last part of the report is about the fiscal resources, the dollars that are going to fund these services. So overall, so this chart represents the total state operating budget in fiscal year 18, which was just under $64 billion. And you see the percentage here that is spent toward children 5 and under, so slightly under 5%. And what's in the report, there's a lot of detail around the fiscal resources, so we actually are going to have a second report which will go into greater detail. But what this report will show you and give you the ability to really peel back this onion and understand, well, of that 4.9%, how are we spending the money? So that 4.9% plus some additional federal dollars that flow directly to the local areas breaks down like this. It's about $3.8 billion total, 46% to health, 41% to early care and education, and 14% to family stability. So just in this example, looking at this largest slice here, if you want to know more about the 46%, where does it go? And you see 3/4 of it, about $1.3 billion, goes towards health care. Okay, well that makes sense, but what are we really doing in health care? Well, you can peel that back, and you see, well, 81% goes toward Medicaid for eligible children, which is the All Kids program. About 19% goes toward women while pregnant and 60 days afterwards. You say, okay, I want to know more about the Medicaid for children. Let's peel that back. And this is how it would break down on a percentage basis for children 5 and under. So again, if you know there's great vulnerability in communities and you know there's a lot of exposure to violence, you might want to look at something like mental health. You say, okay, it's a little under 3% here, but what does that really mean in the big picture? Well, in the big picture of all those dollars that go toward our young children, if we add that back into this visual, you see that it's less than 1% of the dollars we spend for young children goes towards supporting their mental health or social emotional development. Now, no one in this room, I think, can tell you exactly what the best prescription is for the percentages and what they should be, but at least now we know what they are, and we can start having a conversation, is this how we want it to be? Because maybe we need to be doing more or less based on this level of precise information. So we believe this report provides a lot of needed information for real decision making. Imagine you're a legislator, a council member, whatever leadership position you have, and in your county, you now have this information. We hand you a report that has all of those maps and all of the detail behind it to help you understand what's happening in your community. How will this be informative to you that for the first time you have the information to ask a lot more insightful, detailed questions about how the children and families are doing in your community, so that you and your community can make much more informed and hopefully better decisions. Before we didn't have this, but from here forward, we do have this information. So, to discuss the report and the findings, we have a great panel with us today, and I'd like to introduce our moderator, the moderator of our panel, who will then introduce each of the panelists. So Dr. Cristina Pacione Zayas is a true advocate on behalf of our children and an inspiring community leader. Many of you know her from her work at Erickson, where she serves as the Director of Policy, and you may also recognize her from seeing her on WGN, where she provides political and election analysis. We're also excited by Christina's recent appointment by Governor Pritzker to serve on the State Board of Education. In addition to establishing Erickson's Community Data Lab, which brought both the Early Development Instrument and this Risk and Reach report to Illinois, Cristina and her team have launched our Early Childhood Leadership Academy Fellowship Program, and we have several of the fellowship alumni in the room today, including the Lieutenant Governor. So Cristina, I turn it over to you.
Good afternoon. All right, some people know me in this room. They know I expect a response. I'm going to try to make this as painless as possible. We have a short period of time, and I know that a tight ship is run here, so we have to end at 1:10 sharp. So I'm actually going to ask our panelists if you can all join me up here at the table, and then I'll give the highlights of your bios. All right, so to my immediate right, Phyllis Glink is the executive director of the Irving Harris Foundation, founded by Irving Harris, who has just been a huge influence in early childhood, making the connection between early childhood investments really being an economic development strategy. And of course, he was one of the founders of Erickson Institute. But the foundation really focuses on birth to 3 investments, child maternal health, reproductive rights, Jewish values and social justice. And Phyllis also serves as the co-chair of the Early Learning Council, which is the governing body that is established in statute to make recommendations to state agencies as well as the governor about how to proceed in terms of expanding resources and ensuring access in early care and education. To her right is Rick Estrada, CEO of Metropolitan Family Services. This is one of our anchor institutions here in Chicago, founded in 1857, 162 years ago, largest and one of the most respected human service agencies. Rick has been at Metropolitan Family Services since 2011 and has grown the organization by 90% in revenue as well as families served. They cover the whole gamut from cradle to career in terms of their work. But Rick also has experience working in government as the first deputy commissioner of the City of Chicago Department of Family and Support Services, and he was the former executive director of Erie Family Neighborhood House, and he's credited with establishing Erie Charter School. Last but not least, our 48th Lieutenant Governor of the state of Illinois. It is my distinct honor and pleasure to welcome her to be with us, because not only is she just a phenomenal advocate for restorative justice and human rights, but she is also breaking barriers on so many levels, being the first African-American woman to take this seat. And I think also what's really significant is that she comes with grounded policy work, particularly around the restorative justice movement. She was right before this, representing the 5th District in the Illinois General Assembly. You may recall her name leading the efforts to champion preschool expulsion and suspension legislation. Who would have thought that we need that type of legislation to keep babies out of the school to prison pipeline? But she most recently was director of the Center for Public Safety and Justice at UIC and a professional mediator for 20 years. And of course, in our inaugural class of the McCormick Foundation Executive Fellows. So help me welcome them to the table. All right, is my mic on? No? Test, test, test?
Yeah.
All right. So thank you all for joining us. And I just have one question for the entire group, if you all can kind of respond from your unique vantage point as in philanthropy, provider, and then of course government. Now that we have a data tool that gives us a comprehensive snapshot of child well-being and the distribution of public resources to support families with young children, how do you move from what you know to what you do to close those gaps?
Would you like me to start?
Sure.
Thanks, Cristina. Well, thank you for having me here today. I'm really excited to be here. This is an initiative we've been really excited about for a long time. And I think what's so critical and important about having data is that if you can use data to inform the decisions we make, whether that's philanthropically, in our programs, in government, then we can do a much more precise job of delivering services to the kids who need it the most in the way that they need it, responsive to what their unique needs are, their community needs are, and hopefully help us move closer to equity of outcomes for all kids in Illinois, not just equity of access. And so with this kind of a resource, married and coupled with the budget, which allows us to see very clearly where the funds are going, are we investing in prevention? Are we only investing in treatment? While the mental health dollars were small, most of those were in treatment. Not very much of that was in prevention and intervention and helping our kids early. So we can learn so much from this data, and I think from a philanthropic point of view, and I'm with a number of my colleagues in the room who supported this work and who we partner together quite often, it allows us an opportunity to go to our partners in government and the not-for-profit sector and say, what are the gaps? What do you need our help in supporting and lifting up? These kinds of reports are one, but bringing people together to do strategic planning, to think about how one brings best practices to scale in our state. So those are all roles that philanthropy can play, and we can be much more precise in what we're doing and start to really crack that really difficult nut of what kids need, when they need it, in the way they need it, in a more equitable way. So I see this as a really powerful tool.
Yeah, I'll jump in here and say, I was raised and I live and I do most of my work in Cook County, so it was interesting to see the Cook County breakdown in that heat map and to really understand that we're doing really poorly when it comes to the exposure to violence, but in child maltreatment, we're not so bad. And so just helping us understand those nuances of a big county like Cook. But the real takeaway from looking at the counties that I took away, and it's around the issue of equity, right? And I learned about Vermilion as a county and Franklin County, and those are counties that have great need. And so as a provider, as a legislator, as a funder, how do we think about those smaller counties that maybe you don't think about because they're so far south? You don't think about it if you don't live there, but how do we think about it from a perspective of a big historic provider in the city and our county, and how do we support providers in those areas to provide high quality access in the health area, in the family support area, and in the early childhood development area. So it's not only about what we learned, but what we can do to help others that are in other counties from an equity perspective there as well, because equity goes both ways.
Well, good afternoon, everyone. First, Cristina, thank you so much for that kind introduction, and so great to have your comments as well, Geoff. And thank you to the entire City Club and all of you here today for this being here as a part of this important conversation. I would just piggyback off of what both Phyllis and Rick said, in which is the data is important, and the additional piece about the data that's so critical is that we can follow it over time. this is something that we can start looking at and then kind of see what are the trends over time, so that as we are making policy decisions, that they are not made in a vacuum, but they are made based upon data-driven principles. I think the other thing that it does, certainly coming from the vantage point of representing the entire state, and we're thinking about 13 million people in our state, there's a tendency when we think about risk factors to sort of, based upon biases or experience or whatever your own sort of limited viewpoint is, to kind of come up with your own construct of what that, what the risk looks like, or who would be those that fall under those risk factors. And what we see from these maps is that we see risk all throughout the state, and it might be in different areas. And so when we think about funding and budgeting and where we want to have the greatest amount of impact, that you don't just sort of have a one-size-fits-all approach to this, where you just say, oh, well, there's certain children at risk, this is probably what they look like, this is probably what characteristics they have, and let's just add this to the budget. But rather, we can be more intentional and think about where we can be, as you said, Phyllis, strategic about where investments need to be made, and thinking about how we can work, which is very important in our state, and something that the governor and I have certainly prioritized, in working in a bipartisan fashion, to make sure that across the board, when we talk about early childhood education and what's best for children 0 to 5, that it affects every one of us, and it affects every legislative district. And so we should be working together on how to make sure whatever those needs are in those districts, that we are prioritizing those, and that we are getting everybody on both sides of the aisle involved to make sure that we work on these improvements.
Thank you. I'm really glad that you mentioned the risk piece, because the report, in the advisory council, when we came together, we were really wanting to use this as an opportunity to disrupt and reframe traditional definitions of risk, to decouple risk from individual or population characteristics. Too easily, at-risk kids or at-risk communities slip off people's tongues without really thinking about what that means. And I think it's incumbent upon us to really be sensitive to that. And that's why, the reach indicators that we selected were really about what are the policy solutions to mitigate institutional barriers, interlocking systems of oppression, and how can we really put Illinois resources to work to mitigate these risk factors in the environment, not inherently in individuals or populations. And so I'm just kind of curious, Phyllis, from your perspective as the co-chair of the Early Learning Council, how do you see this data supporting the work of the Early Learning Council?
Well, first I want to do a quick shout out to our data committee of the Early Learning Council, because we have been talking about doing this for a while, and they picked this up and started moving this forward in our state, because we recognize at the Early Learning Council that our job is to understand what we know, what we don't know, and how we can help inform in a public-private way the priorities that our state invests our money in, how we spend our time, and also to identify the kinds of challenges or gaps and needs in what we are doing that need more of a deep dive. And so I see this report as sort of central to informing the priorities that we spend our time on, to informing our work over time. Are we making progress on certain things? What needs more attention? What do we lift up? How can we really help this body, help our state partners make the best decisions for the limited resources that we have, and then to figure out what is needed to make a case for where we need more. So I see it as sort of critical, and I think the thing that was so compelling about this is there's also a lot of data we don't know. So if you look at when the report comes out, if you pay attention to maternal morbidity and mortality, which is huge disparities and outcomes across populations, we have very little data on that. We need to know more. We need to understand what the limitations of our data are, as well as where we have good data, and figure out how we push an agenda too that holds us accountable. I see Dawn over there at ICAM, who's been doing this work for our state for years. So this is something we've paid attention to, but having this kind of report in a public way, in an interactive way that we'll have on the website when it's launched, will really, I think, be very helpful to the Early Learning Council and all of our committee work.
Thanks. So speaking of the interactive nature of the report, there is going to be a website in which you can toggle between counties and legislative districts. You can compare risk factors against reach in different ways. There'll be one-pagers for you to download with your county snapshot. I'm just curious too, because as Geoff mentioned, this report is really meant to ignite conversation, inspire action, so that we can really kind of close those gaps. And thinking about that, when we were constructing the panel, we wanted to kind of have representatives from key stakeholder groups, but one of them that's not here are our families. And so I'm just curious, Rick, from your vantage point as a provider, how can this report or how can these data engage families? Because oftentimes I think, sometimes we handle policy at that 30,000 foot level and the people that have to live with it are not involved in those decisions. And so I'm kind of curious, what are some ways that people can use this information to engage families?
Sure. I think engaging families is something that community-based organizations, it should be in their DNA. It should be part of what they do. So if this report would only strengthen that. But I would kind of reverse engineer that when we engage families. And we think about, so what are the barriers to access? Let's just think about early childhood development, for example. Barriers to access for high quality early childhood development in this state. And if you focus even more clearly in the county, if you look at the report, there are 6 funding sources for different kinds of early childhood development services. But for families, they really don't care about your funding streams or your funding sources, right? They think about 2 things. There's child care, and whether it's in an institution or at a home or in a school district, it's child care to them. And if it's high quality, that's the single most important thing. And then there's home visitation, and they don't care whether how it's going to be paid for. They only care that the person that walks into their door ideally looks like them and has an understanding of their experience. So that's what they care about. So if we engage them in that conversation, how do we get that service to be better for you? I think they will lead us through the public policy ideas that I think need to be at the table. One is you need to simplify these 6 funding sources so that all the providers could go to one place and get a full day of early childhood development, not slice it up so that Head Start gets one report and that Block Grant gets another report, et cetera, et cetera. Mm-hmm. So I think the policy implications for us is simplify it. Like the state of Illinois, help us simplify that. It's time to redo the funding formulas. And this, it has, that's the great opportunity before the state, because it's not, it was there way before this administration, but the great opportunity is to do that. And so if we engage families from that angle, the quality, how you want to see it, it'll lead us to the right public policy solutions.
And Lieutenant Governor, can you speak a little bit to a few weeks ago, the governor gave his budget address. Mm-hmm. If you can kind of speak to his proposed investments to close these gaps.
Well, sure, I'd love to. Well, the first thing that I want to say is what I appreciate about thinking about this through the risk and reach report is how it connects the dots in so many ways. I think one of the things that we can do so much better in Springfield is connect the dots between policy issues instead of looking at those issues sort of in a silo or from one singular way. I do a lot of work around criminal justice reform, but if in my work in criminal justice reform, I don't also think about housing and access to health care and education and all of these other issues, then we are doing a disservice to the people that we serve. And I was honored that Governor Pritzker signed a new executive order just about 3 weeks ago as well, establishing the Justice, Equity, and Opportunity Initiative, of which my office will lead, so that we can bring an equity lens and look at all of these issues in a more comprehensive way. So there are a couple of things that I could say when we think about connecting the dots. First of all, I want to say before we even got to the budget, the governor signed the bill raising the minimum wage and made that law in Illinois, raising the minimum wage to $15 an hour. And the reason why I raised that is because so much of what we saw when we think about 20%, I think, of children in this age group living in poverty, then it's tied to that. So when we think about healthy communities and healthy families, they have healthy relationships with the systems in those communities. And when we have so many children living in poverty, it's very difficult to talk about how to improve outcomes when people are just really trying to make it. They're trying to make it. And so I wanted to say that because as we can make families stronger and families being able to pay the bills and take care of their children and put food on the table, that's going to help outcomes for children. And we have to look at policy in that way. In addition, though, in the proposed balanced budget, it includes a focus on rebuilding, of course, the social service safety net, which we know was decimated over the last administration when we went through a 736-day budget crisis. So we have to rebuild, and that's not something that's going to happen overnight. Even with what we've tried to do in this proposed budget, it's going to take a long time, many years, to try to rebuild from where we were. We also included record funding for pre-K through 12 education, including with the Early Childhood Block Grant, an additional $100 million towards that, which is a record-breaking from fiscal, it's $100 million more from fiscal year 19, and I think it's the largest increase that we've seen ever in our state for Early Childhood Block Grant. And then I'll just close by saying you all in this room know that we are working very hard to advocate and have proposed a fair tax in our state because we need to increase the revenue in our state. And one of the ways that we can do so is through a fair tax to bring in the revenue so that we can begin to do the kinds of things that we need to do and to really have that equity lens that we need to have where we focus on how to increase revenue to our state to provide more resources to the people in our state. So I think when we have the equity lens and when we think about justice, equity, and opportunity, as I often say through my office, we cannot have real justice if we don't have equity and opportunity. We just can't. And so we have to look at that and think about what are we doing, where are we investing? And when we propose a budget reflects our values. Our budget reflects our priorities. And so when we say we are investing more in early childhood education, when we want to rebuild the social service safety net, this is because this is important and this is what we value as a state. And that has to be made clear in any budget that's proposed.
Right. Thank you. Okay, 102. This is the segment in which we have time for some public Q&A, and there were some overachievers that sent some questions in advance. I'd like to give a shout out to the Early Childhood Leadership Fellows who did their homework and sent these questions. But I was also pleased that some of them actually are questions I had hoped to ask, and now I get to ask them because they're in here. So Bridget Colling from Highland Solutions. This is a question I was going to ask, so I'm appreciative of you submitting it. What are the most impactful examples you as panelists have seen of organizations working together across focus areas like healthcare, education, parental support to provide holistic care for young children? It's similar to the question that I prepped for you all about in a personal example or professional example where there's a convergence of forces that rallied around children.
Well, I'll start by talking about the work that I did on the bill to end preschool expulsion in our state. Still shocking every time I say it, that 3 and 4-year-olds were getting expelled from school. Disproportionately black and brown boys, increasingly black and brown girls. And it still shocks me because the thought of 3 and 4-year-olds being expelled. But what I saw was, first of all, this was a bill where there was tremendous work being done by advocates in the early childhood education space, organizers, advocates who had been working before I even got to the legislature. So I was pleased and honored to join in with this work to help carry it over the finish line. But in that work, we worked with not only the advocates, not only educators, but we also worked with law enforcement. Fight Crime, Invest in Kids, who joined in this work that we were doing. We worked with families. We recognized that it wasn't just an issue about what was happening at the school, but we had to also engage around mental health and what other kinds of services might need to be available. We also had to make sure that we thought about how to best support teachers. which is another question that we ask that might not always come up. What did teachers need so that they could feel supported? So I just felt like with that bill, which I'm so glad I understand the rules have now been completed and we are moving forward. Phyllis, I know you shared with me even earlier today that we're moving forward with that implementation, but it was just a wonderful example of how you don't just, again, as I said before, have people working in silos, but you think about very comprehensively how to bring all the necessary stakeholders to the table so that their voices are heard and you can have the best outcome possible for our children and families.
Yep. You want us all to give it a shot? So I'm back into that again. So our Early Childhood Development Center in New City, I think it's a prime example of this. One, it was voted by a reader's poll as the #1 child care center in the region. But that's not the real story. The real story of that center is that there are children as young as 2 and 3 that are attempting to hurt themselves. Right? So these are children that have been exposed to an unacceptable level of environmental violence. And so the teachers there are a special group that are themselves experiencing these impacts of that violence, and we're trying to provide support. And so a loving group of teachers working on this group of children that, because of decisions that we have made as leaders in the city historically, have created the conditions in a community that have led to this experience of violence. It's not the folks, it's the conditions that we created. So the reason I said I'd back into that is because there's an effort by about 20 organizations in the city of Chicago trying to help reduce gun violence. It's a historic effort because everybody thinks they have the answer to it if we only had enough funding. And so these organizations are coming together without the dogma of this is the way, instead coming together and trying to figure out what we all do well and how do we enhance and learn from each other. And I think over the last 2 years, we've seen a decrease in gun violence that impacts, at the end of the day, those children so they don't have to witness that violence. Because as some might say, violence is learned. Violence is, I think, exacerbated by the conditions under which you live.
I will build off of what Juliana was talking about. I have a million examples of the way our public and private sectors have come together in the early childhood space. I think it's something that many other states and funders from other places look to Illinois and think, why can't we be more like that in a collaborative way? We started with our colleagues in government and in the philanthropy sector and the not-for-profit sector an action planning process a number of years ago because we felt that mental health and the social emotional needs of children, the needs of the workforce around those issues was regularly coming up in as a need. So we came together with our state partners. We developed an action plan to integrate mental health services across child and family serving systems in Illinois. And from that was lifted up a particular need to address the mental health needs and trauma needs of children in our early care and education settings. And so we, with our state partners and our advocates, developed a table with the Illinois Children's Mental Health Partnership, and we are now in the 3rd year of an infant and early childhood mental health consultation initiative in our state. We're leading the country in that we're developing one high quality model that can then be delivered across child and family serving systems. So that means home visiting, public health, early intervention, early care and education settings. And that remained my happy place through the last 5 years. That table is robust, it's growing. We've seen examples of changes in public systems to respond to it. The rules that have come out around the preschool expulsion lift up mental health consultation as a strategy. And so this wouldn't be happening without our philanthropy colleagues and our advocate and direct service colleagues and our state partners. And we sit around the table together coming up with the model, coming up with a workforce plan. So this is a big lift, but I think the data from this report sheds a spotlight on why it's so important that we provide these kinds of services in communities where children and families are, to strengthen the workforce, to give families the support they need from a prevention and intervention framework so that maybe we don't need to do so much institutionalizing of our kids. And while we're expelling our preschoolers, we're also expelling our infants and toddlers. And once expelled, children tend to get expelled over and over again. So this is really serious stuff. And I think it's really great that the administration and our legislature have recognized it, and we will continue to lift that up.
Last question or comment / comment. It was really important for us for people to not look at our report and just say, oh, this county has high risk, low investment, and the adjacent one is the opposite, so let's just move these resources along. And so I just want to know, Lieutenant Governor Stratton, if you can share your thoughts about balancing building statewide support for investments in the legislature, even when the data may suggest targeting resources in particular areas. That'll be our.
Well, I come from the restorative justice standpoint, which is, and I'm a trained circle keeper and restorative justice advocate, and I always think about what we say in the world of restorative justice, which is that the wisdom is in the room, and that you don't have to go outside of a particular community to identify solutions for that community. What you need to do is engage that community. And so when I think about when there's these sort of outside or external decisions of this is what we need to do, it often means that there has not been real intentional engagement of communities to really make sure that you understand what is going on in those communities and what are the needs based upon the people in those communities. The same people which, by the way, sometimes when we talk about how we think about risk and we kind of, use a broad brush to say, oh, well, at risk, sometimes those same biases come out when it comes to whether or not we should engage communities. That there's a decision that they could not possibly know what they need or what's best for them. And that is the antithesis of what I think this report sets forth, which is that there's different needs. Yes, we might be able to identify risk and we can use data. It could be a data-driven approach. But it has to be coupled hand in hand with how we engage communities and lift up community voice and make sure that people, families, people who are caregiving, are those who are with young people on the ground every single day, that policy is made from the ground up, that's where we include those voices so that we can make sure that we are making the kinds of decisions that reflect not just sort of, let's just have this funding all the way, but we understand what's needed and where. And it's not, yes, the data is important, but the quantitative data and the qualitative data to ensure that we're including community voice.
Mic drop.
Well, thank you very much. You still have a few more questions there, Cristina.
I do, but it's 1:12.
Okay.
I know how you all are.
We have some real tough rules around here. And it's obvious from just looking at the report, which I believe you said will be available March 29th.
Correct.
So this is a little teaser. And the issues that you've talked about, the questions that we weren't able to get to, the City Club would like to offer to Lieutenant Governor, Governor Pritzker, and the Erickson Institute the thought of setting up a 1/2 day or a 1-day program in the fall, perhaps, work with our office, we'll work with your offices, around the various issues that you've talked about today. So I'd like you to take that back, give it a little thought, and we would be glad to partner with you.